Good evening, everyone. I'm Dr. Pranjali Bhagat, and I welcome you on behalf of Indian Psychiatry Society Western Branch for the very first session of this unique Doctor Wellness program, which is a brainchild of our Dr. Sudhir Bhave sir. This program aims to provide information and improve the overall well-being of psychiatrists as well as doctors from other fraternity. This program will cover psychological health, physical health, and financial as well as other areas of well-being. I request Dr. Sudhir Bhave sir, who is a well-known figure as well as a psychiatrist all over India. He is professor in Department of Psychiatry and KP Salve Institute of Medical Sciences, Nagpur, with 33 years of teaching experience and plethora of achievements and awards with him. Sir, I request you to provide some insights into this topic.
Yeah. Thanks a lot, Pranjali. Pranjali has already given an idea about the subcommittee, Doctors Wellness Subcommittee that has been formed for the first time in the Western Zone of Psychiatric Society. I mean, as she has already said, the basic idea is that, I mean, we as doctor fraternity, we are always looking at the patients, trying to improve their lot, trying to help them in different ways, chiefly medical help. But we thought that, I mean, why not help our own brethren? I mean, why not improve the health of psychiatrists and doctors in various ways, like she said. So whether it's mental, physical, spiritual, nutritional, financial, and so on. So, I mean, we can see many more programs in the pipeline in the coming year. And this is the kind of bony of our subcommittee. This is the first program of the subcommittee. And as she has said, this is about physical fitness. And I was just telling Pranjali that, I mean, this is a casting coup done by me. I mean, perhaps assemble the best of the people. Dr. Sadashiv Bhore, who is a well-known fitness expert. I mean, he talks much about nutrition and physical health and lifestyle and many more things. And I mean, I have heard him as a speaker. He's very impressive and has got a very wide knowledge base when it comes to fitness. And when we were scratching our heads as to whom to get as the chairperson for this kind of talk, I think only one name kept on popping up all over, that it must be Dr. Amit Samar. I somehow procured his number, called him up, and he was very kind enough to agree to be here today.
Thank you, sir.
Yeah, because I think Dr. Amit has been putting into practice what Dr. Sadashiv Bhore might tell for the next 1 hour, and maybe many more things with his wide experience. And thanks a lot, Amit and Sadashiv,
Thank you,
both of
sir.
you for being here today. And I welcome you all and wish you all a very educational and very enriching program today. So over to you, Pranjali.
Yes, sir. The topic for today is fitness hacks for professionals, talk on diet, lifestyle modifications, and exercise for doctors. The chairperson for today is Dr. Amit Samar, who has completed his MBBS from IGGM Nagpur. He has completed his Masters in Public Health from Johns Hopkins University, USA. He is the director of Tigerman Sports Private Limited. He won various national and international cycle races. He is founder and director of Miles and Miller's Endurance Sports Academy. He is also known as the bicycle mayor of Nagpur city. He was 4 times full Ironman, 16 times Ironman 17.3, 9 times full marathon runner. To be very true, his achievements cannot be described on slides and cannot be featured in 1 or 2 slides. Uh, Sir, I implore you to please share your experiences and your insights regarding this topic.
Yeah, it's a very important topic. I think I would like to, of course, Dr. Sadashiv sir is gonna talk on it, and yeah, but very important topic on mental health and impact of exercise on mental health, even psychiatric issues. Means I have myself also personally experienced like how how much exercise is important not just for physical health but very much important for mental health and very much important for getting through tough times in your life and I have myself gone back to exercise uh, a lot more because I myself going through tough time. The best thing which I have done instead of going to friends, instead of going to someone and trying to talk about my problems and all. I think the best thing I have done is, gone training and done some good training, good amount of hard work, and that itself gives you so much of positive thoughts and positive things in your life that you can overcome anything. So I have done it myself, and then I have trained many people. I have like in last 10 years, I must have trained more than 1,300 people for fitness, for marathons, for triathlons, for cycling races and all. So I have come across many examples where people have they have really experienced not just a physical transformation but a mental transformation when they when they do exercise, when they do some training, and then when they also achieve some goal like running a marathon or even running a 10 kilometer or so. I think means to start off the program is, I think physical fitness and exercise is not just medicine for physical fitness. It is very important part of mental fitness also. And I also think that especially endurance sports, which we have been doing, long distance cycling, marathon running and all, they teach a lot of patience to the mind. अभी ऐसा अभी एक्चुअली क्या हो गया कि दुनिया में सब कुछ बहुत फास्ट फास्ट होने लग गया है. We have lost patience for even small things, and we have lost patience for many things in our life. So we want everything immediate result. We want because the food is getting delivered in 10 minutes now. So everything so I think endurance sports like long distance cycling or running, they teach us a lot of patience, and it's very important in, I think, today's world to get patience and not look for immediate results or immediate things. So I think sports has a lot to offer, not just physical fitness, but but lot of things like mental fitness, patience, uh, and being positive during tough times. Being positive during good times anybody can be positive during good time. Being positive during tough time is what matters. So I think sports can teach us a lot of things, and physical fitness I think is very important for all these factors. Yeah, I think that's enough to start.
Yeah, thank you, sir. Myself, Dr. Shreyas Magia. I am also one of the member of the subcommittee. Thank you for your insight. Now, I would like to hand over the mic to Pranjali.
Sorry, I muted it.
Yeah.
Now I would like to introduce our speaker for today, that is Dr. Sadashiv Bhule sir, who has completed his MS General Surgery from IGGMC Nagpur. He was 1988 batch student. He has completed his MCH from GMC Mumbai. He has also completed DNB and MNAMS from Delhi in urology. He is the director and chief consulting urologist from Seven Star Hospital Nagpur. He is the director and chief consulting urologist of Ketki Nursing Home and Urology Hospital Nagpur. His area of expertise are endourology and laparoscopy. He has many academic achievements, like he has done workshops on live operative workshop demonstrating a technique of laser enucleation with holmium laser at West Zone Urology Conference in Aurangabad in 2016. He was also invited as faculty to perform live operative workshop on transorbital tape for stress urinary incontinence at Dalby Hospital by NOGS on February 2012. He was also faculty at Medicon conference held at Johannesburg South Africa in February 2010 for a lecture on advances in neurosurgery. He has done various operative demonstrations and in national and zonal workshops. He is practicing in Nagpur since 25 years. He is in fitness and nutrition since 12 years. He is certified nutritionist and fitness consultant from INFS Pune. He is certified exercise coach and bodybuilding expert, which was certified from ISSA US from California, USA. Over to you, sir.
Thank you. Thank you so much. And the wellness committee idea is very good, Bhave sir, and it makes a tremendous lot of difference to the whole community, the West Zone community. And I'm certainly sure that it will become a major kind of opportunity for all the people to learn and also share their expertise in different fields. And I'm happy to have Amit as chairman. Dr. Amit Samarth we share the same alma mater, IGGMC. And I am from 88 batch, he's from 97, I guess. So yeah, so we've run the same grounds together for some time. Then he ran across America, across Russia, and so many other continents. But yes, as Amit rightly pointed out, that running, I did a bit of endurance sport itself, not a lot of it because I'm mainly into resistance training. But if it is always told that you run not with your legs, but with your mind. So after a certain period, it is your mental toughness. It is how you adapt to the surroundings, how you adapt to the atmosphere, the heat, the surrounding athletes, and then how you basically chalk out your race is what is very important when it comes to endurance training. And I'll share my screen now and we will start. I'll give you a brief overview. Since I'm talking in an August gathering of psychiatrists of West Zone, I would like to have an overview because since I am in nutrition, it is my interest. It was my profession for 5 years because I did professional training of people for nutrition and is for 5 years. And then I stopped it because of lack of time, but I still enjoy talking about it and do a lot of research as well. So whenever there is some topic of interest, you always keep on researching. And one of the things which I am really fond of right now is not nutrition as regards bodybuilding, but nutrition in relation to mental health, which is getting widespread kind of, familiarity and popularity in the Western world. Can you see my screen? Can you see my presentation?
Yes, sir, it is visible.
Okay.
Yes, sir.
So I'll start. Yeah, thank you. Thank you so much. So I'll just start sorry. Yeah, so a lot of work has been done as I was talking to you about Dr. Chris Palmer. These are the people who are doing a lot of work on the nutrition and its antidepressant effects or effects on psychiatric illness and mental health. There are very strong neurotransmitters like serotonin, dopamine, acetylcholine, and nutritional manipulation can optimize these particular neurotransmitters. It has also been seen that mitochondrial function is altered and we will be able to manipulate it with simple changes in nutrition if we do that, because mitochondrial function is the basic function of cell. One must also listen to, I'm a great fan of Dr. Georgia Ade. She's a nutritional psychiatrist. And she goes on speaking about two lengths about the importance of nutrition. And she shares her cases and her studies. She has a lot of studies in journals also. And this makes the topic very interesting. In addition to nutrition, as we were discussing just now, exercise helps in decreasing stress. It increases happiness. It prevents depression. One of the most important things about exercise and mental health that people who exercise usually have got a very positive kind of attitude towards life in general, and they have good self-esteem. And that makes a lot of difference when it comes to mental health. In addition to that, it optimizes growth hormone, testosterone, increases endorphin secretion. These are very powerful changes which give you a sense of well-being and also helps you to maintain good physical health. Walking an hour decreases mental health problems by 26%. This is a staggering piece of information which we have today. Just 1 hour of walk can make such an impact on mental health is really astounding. In addition, exercise increases the secretion of BDNF, that is a neuroplasticity neurotransmitter. It improves neuroplasticity, it improves cognitive function. We are all aware of that. Now, what exactly is physical fitness? It's a state of health and well-being, and it is specifically the ability to perform sports, occupation, as well as daily activities. So a physically fit person does not always mean that a person who has got a great muscle mass or who has got six-pack abs. It also means that a person who is very energetic in his professional and personal and family life, he goes on enjoying his day-to-day activities and is always ready to, perform more. And that is not a person who comes home and very tired and not interested, completely disinterested in many things. So this is not what physical fitness is. So whatever job you're doing and whatever extracurricular activities you are doing, if you are in a correct state of physical health and well-being, that means it is fitness. To me, it will be different. To you, it will be different. To every person, it will be different. Fitness is achieved through proper nutrition, exercise, and rest. And remember, all these three words are very important: nutrition, exercise, and rest. All three are important. Now, the American Heart Association recommendation for adults is very clear. 150 minutes per week of moderate intensity aerobic activity. Moderate intensity is like jogging, right? So for example, we'll give jogging or cycling, or 75 minutes per week of vigorous activity, aerobic activity. That means if you're doing it 1 hour a day, say 3 days a week, is adequate to have a good heart. Smoking and sitting, we always say sitting is the next smoking. So what actually it means is that when we sit and move less, we tend to have many cardiac and physical problems. So move more and sit less is the new mantra. Adding intensity to any aerobic exercise is important. See, what happens in aerobic exercise is the adaptability. We'll talk about it later. So it makes sense. And the American Heart Association also advocates that we have to add intensity in little bit of, quantums as we go on exercising. And importantly is to add muscle. A pound of muscle burns 30% more calories than a pound of fat. So it is not, the muscle mass is not only for looking good, feeling good, physically being strong, but also in metabolizing these calories which we eat on a day-to-day basis. So I did one study which was done in West Zone Urology members. It was an online questionnaire through Google Forms. 193 people responded to my question, and it vaguely represents a response in a doctor community or a super specialty community. So my first question was, do you consider health conscious? So 71% people said yes, they were health conscious. Then I asked them, do you track your calories? So out of the 71%, only 30% said that they track their calories, 30% of the whole 193. So that is even less than. So if you think you're health conscious and you're still not tracking your calories, so that is something which we'll talk about. What about macros? Macros are carbohydrate, proteins, and fats. So almost 75% have no idea what they eat in their diet. And most important parameter of fitness today, even mental and physical health, is sleep. So we ask the question, how many people sleep 6 to 8 hours a day? And I'm happy to say that urologists are blessed. 83.9% of them sleep peacefully at night. So how many people in 193, I asked, exercise on a regular basis? Exercise may be aerobic exercise, maybe anaerobic exercise, maybe yoga, some form of exercise daily. So almost 56% said, yes, they exercise on a regular basis. When we ask them how they de-stress, you will be surprised that 40.4 said they had sports. Sports means, I'm talking about team sports, like racket sports or badminton or tennis and cricket and all these things. So 40.4%. And the gym percentage was less. It was 14.5%, and 12.4%, Bhave sir, said that they also distressed with music. So I think a good kind of idea would be to have sports, gym, and music together. So that will give us the maximum benefit. Now, over the years, traditionally, body mass index has been one of the key indicators to say whether you are physically better or not, right? So it is fundamentally is a ratio of your weight to height. So there are 4 categories where we say that being in healthy range is something between 18.5 to 25, but we would say 20 to 22 BMI is really a healthy kind of BMI, but it has got its own problems. Because if you see BMI of people who are exercising regularly, if you see BMI of bodybuilders, if you see BMI of people who have been exercising regularly since years, they have BMI which is much more than what they should have. So they look lean, but their BMI is high. So the next thing to do is body fat percentage. BMI is for public community screening. If you want to know how fit you are, the best indicator is a body fat percentage. There are methods to do it. One is a skin fold thickness, which we do on clinical basis. The correct, accurate method to measure body fat percentage is a DEXA scan. There is a paper in American Heart Association journal which says that their lean mass and adiposity is better in terms of basically predicting cardiovascular events in patients with coronary artery disease. So they concluded that body fat percentage is a much better indicator rather than body mass index, BMI. So in a person like Amit, who is a professional athlete, you will find that his bone strength, his muscle mass will be much better than a normal person of his age because of training and diet. So BMI is not a good indicator. Body fat percentage is a better indicator to know in our scenario whether we're fit or not. So this person is Radhika. She was working with me as my fitness assistant. She was coaching along with me. Now look at her at 58 kgs and look at her at 58.6 kgs. She's much better as far as body composition is better. Her body composition is concerned. Her muscle mass is better. You can see that she has transformed in a matter of around 12 to 16 months. So this is how we determine the fat. Now, everybody is crazy about weight loss. If you ask a cohort of say 100 people what you want to do right now as a fitness kind of thing in achieving fitness, I will tell you 90-95% will tell they want to lose weight. So it's a simple principle of thermodynamics. What you eat and what you spend, energy in is equal to energy out. If the energy out is more, body tends to lose weight. You tend to lose weight. If the energy in is more, you tend to gain weight. Now, the formula is if you have a calorie deficit diet of 500 calories, so your requirement of calories is 2,200. Average person of my build and my work usually requires 2,200, 2,400 calories. And if I go on a 500 calorie deficit diet, maintaining my macros, then I will have a deficiency of 3,500 calories in a week. That transforms roughly into a weight loss of half kg. This is a mathematical formula. It never goes wrong. So if you are in a deficit of 7,000 calories, you lose 1 kg of weight. So you can imagine that. And what is always people, whenever I talk about weight loss, people always ask me, what is the healthy way of losing weight? How much should we lose? The healthy way is around 500 to 600 grams a week. That is something which you should aim for. That is a weight loss where you won't lose much of your muscle mass. In any weight loss program, remember that you will always lose a bit of your muscle mass. But to optimize it, we don't have to go on crash diets and avoid them. So whatever we eat, this is a very technical term. This is called total energy requirement, or in technical terms, in our terms, we call it TEE, total energy expenditure. So 70% is taken up by our basal metabolic rate, 20% is by our physical activity, and 10% is thermogenesis. Thermogenesis, for example, I'll tell you, if you eat 10 grams of protein, around 3 grams is used in digesting that own protein. So that is thermogenesis, one of the examples of thermogenesis. And you must understand two important aspects which are very important for professionals and busy doctors like us. One is NEAT, that is non-exercise activity thermogenesis, and another is exercise activity thermogenesis, which we do by doing endurance sports or cycling, running, doing weights. And in NEAT, these are the calories which are burned during spontaneous activity. For example, if you're two chambers and you're going in between chamber and seeing a patient and sitting down and explaining to him, then getting up, then again examining him. So these kind of activities which we inculcate into our daily routine are called NEAT, non-exercise activity thermogenesis. And these are very important because if we do them, then it is quite easy to expend around 200, 300, 400 calories during our professional work, which adds up to a substantial amount of calorie loss during a month's time. So we do everything. मैं सुबह उठ के walk करता हूँ, I go to swimming, but why you're not losing fat? What is the reason? What are things which are getting wrong, which we are not doing right? The first important thing is not getting enough sleep. Now, why that happens is because of the interplay of stress hormones like cortisol and so many other factors which are important. Our recovery is in our sleep. Rapid eye movement sleep is one of the most important aspect of fitness. So if you get good sleep without taking a medicine or without drinking alcohol, and you're getting a good sleep at the end of the day, that speaks volumes about your fitness. They're not drinking enough water. So if you don't drink water, do you know that most of the time thirst is interpreted as hunger? So if you're dehydrated, most of the people, instead of drinking water, eat something, some snack, and that adds to the calories. Not eating enough protein. This is one of the most important aspect of Indian diet. We don't eat enough protein. The protein requirement is important, and we'll talk about it in details. Overdoing your cardio training. Sometimes cardio training overdoing also does not result in losing fat. You will lose weight, but we want here to lose fat, selectively lose fat. We don't want to lose muscle. And why we don't want to lose muscle, we will be talking as we go on. Adding too many oils and dresses, eating too many, some of the healthy foods which are marketed as healthy foods are basically processed foods which are extremely bad for our health, but the media pushes them and we also consume them. And as I told you in our study, almost 79% people had no clue of their calorie intake. So this is something, and we have to trust the process. You cannot become Amit Samarth in a day or a month or a year of training. It is a decades and decades of training, hard work, injuries, and recovery from those injuries, and keeping a focus. So all these matters. A good nutrition plan is the most critical aspect in achieving fitness, health, and remain cornerstone in life of an athlete or a common man. So these are wise words. A wise man said this. That wise man is me, actually. I decided. But anyway, so the thing is that when we speak generically, if we say what is important in fitness, exercise or nutrition, so it is 70% nutrition, what you eat on day-to-day basis, and 30% is exercise. So it is that important. Abs are made in the kitchen, arms are made in the gym, but abs are made in the kitchen. So remember this. And there are various diet strategies. So I want to address this. So every time we come up with a new fad, there was a fad that we take frequent 5 meals a day because that will rev up keep our basal metabolic rate high. And frequent small meals was one of the very strong kind of recommendations. Then came intermittent fasting. OMAD is one meal a diet. And I'll tell you, OMAD, people follow it. I have a friend, my gynecologist friends, is doing OMAD for a year. And he's been on since, and he's adjusted to it. So we find it difficult to believe it, but people do that. And then, of course, there are different types of diet: Dikshit diet, Mediterranean diet, keto diet, so forth and so forth. But basically, what is more important is the amount of calories you consume to a 24-hour period. 24 hours consumption of calories, 24 hours expenditure of calories. So if you're in calorie deficit and you maintain your proteins, fats and carbohydrate ratios properly, it will work for you. So you divide those calories. Suppose if you're having a 1800 calorie diet, you can have it in 5 meals, you can have it in 1 meal, you can have it in 2 meals like Dikshit diet, or you can do intermittent fasting. Doesn't change. Ultimately, everybody agrees at the end of the day, all these strategies are basically to keep your calorie intake optimized, to decrease your calorie intake, to keep you in a calorie deficit diet. Suppose you are doing a Dikshit diet, you are eating twice a day, and in one meal you are eating 1500 calories, and other meal you are eating 1000 calories. So no, you will not lose weight. That is not the thing which is done. So these strategies suit somebody. So intermittent fasting is very popular now. So many of my friends, so many of people I meet are on intermittent fasting, and they are very happy. And that is important from hormonal point of view also, because till the sunrise, till noon, we have a different cortisol level. So we want that we should not consume any calories or any carbohydrates to spike up or to increase the insulin level. Insulin cancels everything. It cancels growth hormone, and it cancels cortisol recovery period. So if you take a kind of tea and some idli in the morning as breakfast, that means that you have secreted insulin, and whatever your body is trying to repair or recovery of your body will actually be delayed or it will stop. So that is why intermittent fasting has got some basis, but all these things are very controversial and they are topic by itself. So I'll be just touching them and I'll come to you in question and answers, whatever you want to ask me about it, I'll be very happy to tell you. So when we call macros are basically proteins, fats, carbohydrates. And the fourth macro is alcohol, because alcohol has calories and it doesn't have any protein, and it has some of them have carbs. So we have to address all four when we are addressing a professional group of people like us. So proteins are the most important macronutrient. It is a building block. The minimum requirement or recommended is 1 gram per kg body weight, and it is very difficult to maintain 1 gram per kg body weight with the type of diet we eat today, particularly the Indian diet. It is badly deficient in protein. 1 gram of protein contains 4 kilocalories. And as I told you before, 30% of ingested protein is used for its own digestion. So if you eat 1000 calories of protein, you have actually consumed only 700 calories. And there was a lot of fat shaming and fats are bad and this, but you remember this, that fat is not responsible. Fat in diet is not responsible for fat on your abdomen or on your tummy. It's an important dietary source of essential fatty acids. You must know that testosterone and estrogen, two elixirs of physical fitness, are basically have their basis as fats. So if you are deficient on fats, and if you're on a strict vegan raw diet, you tend to lose this, as also vitamin A, D, E, K. I'll just draw your attention to one very famous Instagram influencer. She was a Russian. She was on only raw food. She was eating only nariyal pani and raw fruits. She did not eat anything for last 10 years. She died about 3 days back. She died because of multiple vitamin deficiency. So all these fats, we have to accept that body is a machine and we have to feed it. Now remember this, that fat soluble vitamins are important source in maintaining our health. And the most important aspect of consuming fat is that it maintains satiety. So if you eat carbohydrate, you tend to feel hungry after an hour or 90 minutes. That is because the insulin goes up and the insulin falls as the carbohydrate is digested from our body. And that makes you feel hungry again. You eat 2 cheese cubes of from Amul or any other which you eat normally. Eat cheese slices as fat, or eat whole eggs, and you see how they maintain satiety. So protein and fat maintain satiety, which is very important for not feeling hungry. I will draw your attention to certain people who feel that they always say कि मुझे हर समय भूख लगी रहती है, because they are not properly consuming their fats and proteins. Now, carbohydrates are highly overrated. Why I say overrated macronutrient? Even I know people who are not diabetic, who, even if they remain hungry for 3 to 4 hours, they say, मुझे ना hypoglycemia or I need to have some chai or I'll eat something. No, your body is designed to go without carbohydrates for hours together, for days together. If you're not diabetic, you will be able to know that your body will switch its fuel from carbohydrates to other sources. And we are basically gatherers and hunters genetically. So gatherers and hunters means we used to find food, we used to hunt for food, and after a meal, we used to go hungry for 24 to 40 hours or 72 hours, 2 to 3 days. So that is our genetic basis. That was how human beings were. And then as we evolved as a race, we tend to overrate our foods. And one important aspect of carbohydrate, but it is required for protein absorption. So insulin is a naturally anabolic hormone, and we require it for protein absorption and protein also deposition in proper myofibrils. It is stored as glycogen in liver and muscles, and whatever excess is there, goes into visceral, peripheral fats and abdominal fat. The exact minimum requirement is not known. So you have essential fatty acids, you have essential amino acids, without which human survival is not possible, but you don't have essential carbohydrates. So that is the reason, and that is the basis for ketogenic diet. So you can go on without and live a good life without having taken the minimum requirement carbohydrate. And if you see Davidson, the book of internal medicine by Davidson, now they are saying that the lowest kind of carbohydrate requirement for a diabetic is not known. It is somewhere around 100 grams, but it is not exactly known. So various people respond differently to carbohydrates, but they are not essential. Now, supplements, should we take supplements in diets? Yes. So if you are deficient in protein and if you're not able to make that protein, then the obvious option is whey or casein protein. They are derivatives of milk. Creatine is one supplement which can be taken very safely. There is a lot of scientific data on creatine, and 5 gram per day is absolutely a safe dose. It also causes decrease in the incidence of Alzheimer's and dementia. It improves cognitive function. It improves muscle strength. It helps in recovery. We will talk about creatine, and I think in one of my lectures when I talked about creatine, the whole half an hour discussion went on creatine alone. And people always tell me whey protein लेने से मेरी kidney खराब हो जाएगी. Even doctors, I'm telling you. So if you have a normal baseline renal function, which is good, and if you are not a patient of stone disease, then you can consume protein without the fear of having damage to your kidneys. This is standard urological data or nephrological data I'm talking about. So bodybuilders or athletes who compete in big competitions, they can go up to the consumption to 2.5 to 3 gram protein per day, per gram per kg. So we need to at least consume 1 gram per kg. So if you're 70 kgs, you have to consume at least 70 grams of protein. If that protein is coming through, if you are a mixed diet or a non-vegetarian diet person and you eat eggs and chicken freely, and if it is coming, if you're calculating your macros and if it is coming as adequate, then you don't have to take it. It's not magic. It is only to supplement your protein requirement, nothing else. And there are other supplements like zinc, calcium, vitamin E, then magnesium is very important. So these are micronutrients which we need to supplement sometimes, but it's quite it is a quite detailed discussion about supplements. So for normal persons, I would say that we supplement protein if it is deficient, and we can always consider and read and consider ourselves about consumption of creatine, which is a very safe kind of supplement. When it comes to exercise, when to do, how much to do, do I have to get up in the morning? I cannot get up in the morning. You can do it anytime. You can do it in between your two OPDs. You can do it in the evening. You can do it at night. There are people who do exercise from 10 to 11, professionals. We always see the glamour side of Bollywood and Hollywood, but you see there is something called a 4 a.m. club. So people like Mark Wahlberg or Akshay Kumar, all these people who are fit, they get up at 4 o'clock in the morning. They don't do partying. They sleep at 9. They get up at 4. Then they exercise for 2 hours. Then they go to work. So it's all about your commitment. But it is not that a particular time of the day is good for exercise. Overall, in the morning, your empty stomach, you do exercise, you tend to gain some benefit out of growth hormone secretion. But in the evening, when you do, you're warmed up, so there are less injuries and there are less chances of, having injuries in the evening. So both work. Doing something instead of doing nothing is something we should do. So between two OPDs, if the road is better to walk and you can just say walk 4 to 5 kilometers, it's a winter afternoon is quite pleasant in Nagpur, you can just do that. Inculcating activity in normal day-to-day professional work is the most important aspect of maintaining health and exercise and physical well-being. Now, we know that it boosts immune responses, it helps one to achieve goal and remain fit. Basically, when we classify exercise, it is basically into two types, fundamentally aerobic and anaerobic exercises. Aerobic exercises, also known as, we call them cardio exercises, and it is basically low to high intensity. It requires free oxygen, and in this particular physiology, carbohydrates are aerobically turned into energy. So we tend to breathe a lot and we tend to use oxygen for utilization of carbohydrates into energy. So they are most popular and they're easiest to perform. And I'll tell you one thing more thing. Traditionally, if you see, most of the exercise benefit studies till the last decade were done on aerobic exercises. In the 1960s, 60s, and late 70s, American Air Force came out with their own aerobic exercise protocol where they said these are the best. And weight training was put on the back seat. But now we have got adequate number of scientific papers on weight training as well. But the fact remains that they are easy to perform, they are very popular, and more importantly, if you are in a group, these kind of exercises are fun activities. So you meet in the morning, you go for a 5 or 10 kilometer run. It helps you to maintain a very good happy state when you do that. Then there is something called HIIT, high intensity interval training. This is a burst of aerobic exercise in a limited period. And then there is functional training. I'll give you an example of functional or circuit training. These are 4 or 5 exercises which are done and in rapid succession. Then there is a rest for about 60 seconds and then we repeat them. So what is happening is we are training different parts of muscle and we are also exercising aerobically. So if we achieve what we achieve in 90 minutes of steady state exercise can be achieved in less than 30 minutes of high intensity interval training. But a word of caution. Now see, high intensity interval training, one is that you are bound to have injuries in this because it is intensive training. Second, it rapidly raises up your heart rate. So this is something which we don't want after the age of 40. We don't want sudden increase in heart rate, sudden increase in what do you say, the stress on your body, cardiovascular stress. So steady state, what it does is it improves it. It gives you time to adjust, your heart to adjust. So we advise people not to do HIIT priority. First start with cardio, steady state cardio exercises, aerobic exercises, then turn to HIIT. Now, what is the problem with aerobic training? You will see that so many people will go on regular walking every morning, or you go to any swimming pool, you will always find, very rarely you will find, or you'll see a person where you will, you will feel कि यार मेरा physique बंदे ऐसा होना चाहिए. That is because of the adaptability. Traditionally, aerobic training, the adaptability occurs in less than 7 to 8 days. So we rapidly adapt. So if you're walking, say half an hour every day, you started, first 7 days, you will get the maximum benefit. Then you have to increase it by 10 minutes, or you have to increase the intensity of walking by when you walk for the same amount. So you have to increase either the intensity in the same duration, or you have to increase the duration. There is lack of neuro recruitment of multiple muscle groups. So when you are running or when you're cycling, you don't exercise your posterior chain. So that is the kind of thing. So people who do these kind of endurance exercises, they have separate gym sessions to improve the strength of their posterior chain, or some unused muscle, say the posterior deltoid. You will never do that. And as surgeons, when we work, our posterior chain is important because otherwise we tend to have cervical neck pain, shoulder pain. So for a professional like me, weight training also is very important. So the word is walking, only walking is just not enough, or walking is just not enough. It is a good exercise. We have to do it, but just doing that is not good. So we come to resistance training. We can use bands, we can use weights, we can use our own body weight, and all types of muscle groups are exercised, can be exercised. This is one of the beauty of strength training, that you can isolate, you can do compound exercises, which involves multiple joints, multiple muscle groups, and you can also use certain kind of, you can isolate certain muscles and do that. Now, a word about weight training in women. Is it indicated? Absolutely. I'm telling you, given a choice between a man and woman, if they have to choose weight training, a woman should choose it first. The reason being, after the age of 45, a woman who is doing weight training 3 times a week has 50% less chances of fractures overall and 40% less chance of vertebral injuries. That is the data. Second thing is the loss of bone density or osteopenia. The loss is 1 to 2% after the age of 30 every year. And there's loss of 8 to 10% of muscle mass every decade after the age of 30. I'm not talking about 50 or 40, after the age of 30. Women tend to be bigger losers because they don't have testosterone. Their testosterone levels are minuscule. Men are protected with testosterone. So it is very important that they maintain their muscle mass and bone density. This also improves motor control. So there are less falls. And even if there are falls, because of muscle, the number of fractures are less. Because of bone strength, the number of fractures are less. It improves posture. It improves strength. It improves their cognitive function. And very importantly, for diabetic patients and even for normal patient, it improves cognitive function. It increases insulin sensitivity. So strength training, as I told you, muscle tissues burn more calories. And when we train, after the muscle training, the muscle tends to keep on, utilizing those calories for recovery for 40 to 72 hours. There is also something called as delayed onset muscle soreness. That is one of the term which is used. So once you come back from the gym, that day you won't feel anything. Second day, everything will be very tender. For 2 days, you'll be tender. So there is recovery going on. And whenever there is repair going on, there is consumption of calories. Muscle hypertrophy is something which is really hard work. And what happens is when you strength train, there are myofibril breakages. And with rest and nutrition, they become stronger, larger. So one of the great benefits of doing weight training or resistance training is we can progressively overload. So if you're doing a chest press with say 15 kgs dumbbell on the second day of week, when it comes back again, you can just increase it by 2.5 or 5 kgs. So you are not letting the body adapt to a particular load. So progressive loading is the most important aspect of weight training. And one important thing is you don't have to increase your duration of exercise. What you have to do is you just have to pick up a more dense weight or more weight. So calisthenics is actually a way of using your own muscle, your own body weight for exercise. So there can be pike push-ups, different type of push-ups for different development. We can have free squats. We can have stiff leg dead lifts with some kind of weights, and these help you maintain that muscle mass. It is not very effective, but calisthenics is a different kind of exercise science altogether. And you will find some of the fittest people in the world follow calisthenics. A word for yoga for health. Yoga, I always believe, is not only physical exercise, it is a way of life. It is excellent for flexibility. It is good for mental health. But if you put it in terms of muscle gain or maintaining of muscle mass, I don't think yoga is a correct kind of a correct thing. You have to do some kind of strength training. Also, yoga is not the only option of improving your cardiovascular fitness. It does to a certain degree, but once you gain the certain level of expertise in yoga, it will not really challenge your cardiovascular system. But yes, it is one of the most excellent ways of keeping your body flexible, and more flexibility is equal to less injury. So how do we maintain weight? There's something called weight maintenance. So if you eat the number of calories you consume, the number of calories you spend, then you do weight maintenance. Once we have a proper calorie goal or the proper macros goal, we maintain that. We increase activity, we build muscle, we sleep well, and we share our lifestyle with our friends. We remain in that company where this becomes more important. And a man is known by the company he keeps. So that is very important that we stay in company of such people who are basically passionate about fitness. So we must also be very wary that if you have a cola of can of Coca-Cola, it is 140 calories. So it takes 23 minutes of walking to burn that off. And there is just some data which I read today. A can of Coca-Cola will reduce your life by 8 to 10 minutes. I don't know how far it is true. I'm just trying to go through it, but that is just come together. So we have to be very wary of things we eat. Whenever we go to a market and we buy stuff, we have to read the fine print, whether this is processed food or not. Our greatest kind of bad impact on our lifestyle has been processed foods. And also now our children have got access to Zomato and Blinkit and everything, and you just order food which is absolutely unhealthy in many ways. So we have to train our children also. Childhood obesity is on a massive rise. So how do we do that? How do you inculcate healthy lifestyle? We increase NEAT. So on day-to-day work, we increase it. So I don't see a patient sitting down. I'm always standing when I'm seeing the patient. Patient मुझे देख के फिर से खड़ा हो जाता है, फिर मैं उसको बैठाता हूँ. इसमें मेरा 1-2 कैलोरी जल जाता है. Then I go to the next. I have 2 chambers, so I go to next. Till this patient clears out, I will see that patient. I'll coming back. Then I'll go to the OT. Then I'll do OT. Then I'll come out. Then I'll sit, have coffee. Then again go. So this is how you increase the NEAT. And of course, exercise. Even if you exercise 15 to 20 minutes a day, it is a start. All exercise regimens must contain aerobic training as well as resistance training. Both are important. We have to cultivate good dietary habits. We have to combat stress. We have to learn how to combat stress. Stress will be there in everybody's life. And we have to do all this to maintain a good hormone milieu. Now, when we talk about what things work, the simple things which work 95%, which has impact on 95%, and which we should never forget is, most importantly, is calorie deficit. And we have to increase our consumption of protein. We have to eat good quality proteins. We have to have enough sleep. Good quality proteins, whether we should talk about dal. Whenever I talk about protein, people always, I eat dal. But you must know that dal is not a good protein. It is protein, but it's not a good protein because the amino acid sequence of dal is not good enough for our body. The absorption of dal is erratic. Many people get heartburns and a lot of acidity with dal. So not one thing. We want to find out what is good qualitatively and what works for us. And I told you that sleep is the most important parameter. Learn to combat stress, use music, go exercise, run, swim, do something which improves, takes your mind off your problems and helps you concentrate on something new and something which makes you happy. Uh, Kick out processed foods from your refrigerator. Don't take processed foods and don't feed processed foods to your children and grandchildren. That is the worst thing. Even if you don't do anything, if you just basically concentrate on eating foods which our grandfather, grandmother used to eat, we will be more healthy than what we are. And as I say, the holy grail of fitness is strength training. The other 5% is, what ratio you eat, how many times you eat, and do you do intermittent fasting or do you do cardio? These are all 5%. 95% is what I basically listed here. We have to eat right. We are not saying that human civilization has survived because of their need, their hunger. They have grown, they have hunted, they have invaded, they have grown food, they have learned farming, they have worked hard just to eat. So you cannot keep a person hungry forever. Someday he's going to eat. So what we don't keep them hungry at all. We give them good options. So you can see the option on the right. It is far more fulfilling. It is nutritionally far more better. And still it has got 30 less calories. So how do I do it? I am myself, I'm at home. How do I do it? It's very simple to design a diet. Now to you have AI. So in AI, if you just type in your mobile that I need a diet of 1600 calories, I am vegetarian, send it to me in Hindi, Indian diet. So you will get a diet of 16. You can also maintain how much protein you want and everything. So it's very simple now. So how do you do it at home? So you first calculate the calories. So if you want to lose weight, if your calorie requirement is 2200, I would say go for a 1700 or 1600 calorie diet. 1500 calories एक हाथ बार निकल जाती है. मतलब you cannot track in every calorie every time. So keep a deficit of around 600, 700 calories. Then the most important macronutrient to add first is protein. So suppose I am 80 kg, so I need 80 grams of protein, or I take 1.2 grams. So 80 grams of protein roughly is 8 for the 32, 320 calories. So 320 calories are gone. Now we must have 30 to 40 grams of fat. 1 gram of fat is 8 calories. So 30 grams of fat is 8 to 24 to 40 calories. So this much is gone. And lastly, when the calories remain, you add carbohydrates. That much carbohydrates you have to eat. Now, why do you need carbohydrates? Because it makes you feel better. You're addicted to them, and then you need them to, for absorption of proteins. So you lastly add carbohydrates. The first important aspect is protein. Second important is fat, and third is carbohydrates. You are unlucky if you are trying to lose weight. If you are lean and healthy and you are thin, that also does not mean that you are healthy. Thin people are not healthy people. That does not transform into being a fit person. So bulking is much more difficult. Putting on muscle mass is much more difficult. And after a certain age, it becomes next to impossible because we have to eat in excess calories. We have to take excess of proteins, and we have to make sure that whatever we eat gets absorbed properly. And in people who want to bulk muscle, we ask them to avoid cardio. We ask them to do cardio to the minimum just to maintain a healthy heart. So maybe 2 sessions a week of fast walking or stair climbing is adequate cardio for them to maintain a healthy heart. So a word about gut microbiome, everything boils down from your physical well-being to mental well-being to everything boils to now there's a mind-body-gut connection. So eating fermented foods, having kanji, then maintaining good kind of bacterial population in the colon basically transform into a better health. Many psychiatric illness like depression, anxiety, ADHD are again now getting related to gut microflora. And if we consume good, healthy, whole fruits, that improves gut. I will tell you about some of my friends who have been my friends in school. School से उनको वो fat shaming चालू हो जाता है, मोटा है, मोटा है, मोटा है. During our time, there were only 1 or 2 in one batch. Now there are 20, 30 in one batch. And since last so many years, we are 35, 40 years, I know them. They don't eat anything. They eat very simple, but still they don't tend to lose weight. Why is that? They don't have any hormonal problems. All these have now got related. We got the answer. The answer is the gut microbiome. That is a very important aspect of overall physical and mental health. So what is important for gut health are whole fruits, then whole legumes, cabbage, whole grains, chickpeas. These are all basically prebiotics which are available in our diet. And probiotics like fermented food like dahi, kanji, then kimchi is one fermented kind of raw vegetable which comes from the Korean cuisine. That is also very good. Dark chocolate is good. And also, if the fiber content is less, husk. So, how much fiber do we need? We need 30 to 40 grams of fiber per day. Now, these are some of the blue zones where people have survived. For overall, the survival rate age is more than 100 years. So these are Okinawa in Japan, Sardinia in Italy. So you can see that Costa Rica, Greece. So Europe, Asia, California, a place in California, that is also a blue zone. So what is special about these blue zones? The blue zones, the basic pyramid, if you see, that they eat very wisely. They have 80% rule. So the Japanese, in the Japanese culture, they say that if you're 80% full, they stop eating. They don't eat till they're completely full. And they have a community, their activity levels are more, they have a purpose to life, ikigai principle. Everybody should have a purpose to their life, and that makes it really that makes a tremendous rate of difference. And you can imagine a California where there is massive obesity. You have a small blue zone where people are very healthy and they survive 100 years, more than 100 years. So 5 questions to get you started is, what do you want to accomplish? You must have a kind of goal in mind. You cannot do anything without goal. You want to take part in a marathon, so you want to train for a marathon which is going to come after 6 months or 1 year. You want to be flexible, you want to lose weight. So we as guides, or we as people, have to realize this, that we have to avoid extreme and unrealistic expectation. मेरी 1 महीने में शादी, मेरे को 10 किलो कम करने का. This is a very reasonable kind of request from many of our friends and clients and colleagues, but that is not something. This is a realistic expectation. You cannot lose 10 kgs in 1 month, and if you lose it, you will be unhealthy, you will fall sick, and you will put it back again within no time. So you have to define what you want. You have to have friends and family for motivation. You have to be in that group which wake you up at 6 o'clock in the morning to go running. We should have a standard workout plan. We should have a nutrition plan. Then only things work. And we should have patience. If you are something, सबको घाई है सब कुछ अच्छा करने के, लेकिन in fitness, you cannot buy it, you cannot get it fast. It is something you cannot buy it with bitcoins also. So there is something which you have to earn over a period of time, and that is what makes it so so glamorous. And we have technology, we have to use your guided server, we have step counters, we can monitor metabolism, and you can monitor glucose level. I want to tell you something very interesting about glucose monitoring. So CGM, continuous glucose monitoring, is something which is very easily available to all of us now. And you will be surprised. So there was a very large study which was done among people of different dietary cultures. And we thought that, okay, rice खाने से ना मेरा sugar बहुत spike होता है. तो we should avoid rice. So they tried different kinds of diet in different people, and you will be amazed. So poha in you will cause a massive spike of sugar, but in some person it will not cause. And the same amount. So eating something like cheese slice sometimes will cause in some people a massive spike of glucose. So CGM has given an insight. We got a new kind of scientific fact that every diet aspect has to be tailor-made. It has to be customized to that particular individual. And it is so amazing. Just look it up. You have to, if you are interested, just look at continuous glucose monitoring, its impact on diet, and the amount of foods, the impact of foods on continuous glucose monitoring. You will be amazed. Even the same person, if the same kind of carbohydrate, if you eat in different kind of form, your glucose monitoring will be different. The plan is to keep the glucose low. So if the glucose is low, the insulin is low. If the insulin is low, the insulin receptors work well, and there is longevity. So be kind to yourself. You have to leave criticism, and I'm telling you, you have to be very patient. You have to believe in the process and go slowly. You cannot directly jump onto the Mount Everest. You have to climb it from below upwards. And we have to have self-motivation. Ultimately, it is your own motivation that will take you there. So many people come to the gym and they will take their mobile out and they'll do social media and Instagramming and everything because their wives and girlfriends tell them, go to the gym, go to the gym. Then they come here, they do time pass for 45, 50 minutes and they go back. So you are the man in the mirror, you is your greatest motivator. If you decide, then only you do. And we also have motivators. So you have to look at these people. They are these are amazing podcasts. Dr. Andrew Huberman is a neuroscientist, and you will find amazing science in his podcast. And everything they talk is scientific. They have references and they will not do loose talking. A Diary of CEO is another such podcast. Luke Cotino is an Indian. His name is from Goa, and he's one of the leading nutritionists of the world. So these are something, some people you should look up to, and you will find kind of scientists, neuroscientists, nutritionists, exercise, all kinds of people coming into their podcast, and it is amazing. It is much interesting than watching any movie on Netflix. And then you have some fitness influencers which one can follow, and extreme of ages, a 60-year-old having a fitness of a 30-year-old, and that what keeps us inspired, and that what helps us to do better. Thank you so much for all your hearing. And lastly, we would say, when we want to start, if you want to start from tonight's dinner, small portions, next day morning, delay the first meal as long as possible. Just go beyond afternoon. Don't take breakfast. Breakfast is anyway overrated. Add fats and proteins. Kick out sugar from your diet. Decrease another white poison, salt from your diet. Eat whole fruits. Don't eat processed foods. Increase the activity. So if you are watching India New Zealand final, what you can do is every time Rohit eats a 4 or a 6, you can do 10 squats in front of the TV. That's the idea. That's the idea of watching a TV. So during the day, if you're with your friends and you do this kind of fun activities, these are activities which basically go a long way in maintaining fitness rather than achieving it. And always remember that fitness is a journey and never a destination. And whatever level of fitness you are at, you will always find a person who is fitter than you. So that is something we should not depress your, put you down, but that should inspire you to do better. And the desire to become fit always comes from within. Thank you very much. I am open to all your questions and queries. I'll stop my screen sharing now. Thank you.
Thank you, sir. Thank you so much. It was a real eye opener. Everyone must have realized what they are doing right and what they are doing wrong. You even gave micro information about health issues, which I don't think so anyone pay attention to also. Uh, there are few questions we have here. Uh, Sir, what is the desirable ratio of cardio versus muscle training per day?
Per day, I think what the person meant to ask was per week or in a exercise program. So it depends on your goal. For a person who wants to run marathon, then the ratio is different. So what you want to do, what your ultimate goal is, it all depends. For a person like me, I usually tend to do 3 to 4 days of strength training and 2 days of aerobic training. If it is not possible, at least 3 days of resistance training and 1 day of cardio training. It is not necessary for people to go to the gym every day. So you can do the same kind of amount of exercises, which is what we do as professionals, as busy people, that sometimes during the OT days we come out late, so we are not in the mood to exercise. So whenever we are free, we have our defined quantity of activities or muscle training or aerobics to be done, and we do it in 3 to 4 days. And if 2, 3 days you don't go, it's fine. So it's not necessary to go to the gym every day. Second, to answer to your question is that it all depends on your goal. For a normal person who wants to follow fitness, who wants to remain healthy, who is not having a specific goal, I would say then again, it depends on your age. It depends on the kind of work you do. So professionally, if you're sitting in a chair for a long time, I would say resistance training for at least 4 days and aerobic training for 2 days. That is what we plan. But it's very subjective, isn't it? Amit, what do you say about it? Unmute yourself, please. Unmute yourself.
Yes, it is very subjective, and because in endurance sports we do 4 to 5 days of endurance and 2 days of strength training. And some days we do strength training also, and then we do endurance also. Both, like morning we will do endurance training, and then evening we will do strength training. So it depends on person to person, and it also depends on the goal of the person. If somebody is very if he has some big goals, very, then he will train more. If like um I think for general population, I think it should be 1 days of cardio, 1 day cardio, 1 day strength, 1 day cardio, 1 day strength. Even if you do 3 days of cardio and 3 days of strength training, you can gain lot of fitness. But that has to be done consistently over many weeks and months. Then only you will get fitter, and your both endurance as well as strength will improve.
Yeah, and one thing which I want to tell about it, so it will take some time for you to achieve a level, but you will always be better than what you were yesterday. Always remember this. So we tell the people to hang on for 2 weeks. So people will say कि मेरा ये दुख रहा है, वो दुख रहा है, started, मैं सब कुछ दुख रहा है. Then we just tell them to hang on for 2 weeks. In 2 weeks time, people start appreciating themselves. कि no, I'm getting better. This is getting better. I'm getting more, because the inflammation in the muscles and everything also adds to that particular feeling that you are better. And once you go to that initial, area, then it becomes very easy for you to remain motivated. One important aspect, what Amit told you was aerobic training in the morning and strength training in the evening. Yes, that is one strategy which is done. But you should never do aerobic training and anaerobic training or strength training in the same session. I'll tell you why. So you do weight training, you align your body to be anabolic. You're basically trying your body to be anabolic. And then you do half an hour, 45 minutes of aerobic training. No, that is not right scientifically. So you can do morning, evening training, or you can do alternate day training, or people like us who want to maintain muscle mass will do strength training for 4 or 5 days and do cardio to maintain a healthy heart for 2 3 days.
So there is another question by Dr. Khyati Mehtali.
Yeah.
How significant is 10,000 steps?
Yeah, so we need some empirical kind of a figure to adhere to. So why 10,000 steps? Because 10,000 steps is equivalent to walking or activity of about 5 kilometers. And when you do 10,000 steps, and it is said that you have done adequate activity for that particular day. But empirically speaking, it's just an empirical kind of somebody said 10,000 and it just stuck. So it can be, it is got nothing scientific in 10,000 figure, but then it has become standardized all over the world globally. And then it helps you compare yourself to the global standards. So there are 10,000 step clubs. So they are online clubs you can join. So you can show them that 30 days I've maintained 10,000 steps. So it became an empirical figure which you actually stuck with people.
Sir, how significant means, what is your take on pilots?
Take home
Pilates, that Pilates.
Pilates.
Pilates, sorry.
Pilates is an excellent form of exercise. It is a gentle form of resistance training. It is resistance training in a wild form is what we do in the gym with free weights. Pilates is a very kind of controlled resistance training. But if you see the overall fitness, Pilates mostly, I should not say this, I'm not being sexist or racist or anything, but usually women prefer to do Pilates. Men don't do Pilates to that extent, but I have done it myself. It is an excellent way of doing resistance training, and the number of injuries which happen in Pilates are less, and we can control the resistance in a much better way. So yes, it is good. One thing Pilates course over standard strength training is that the core training in Pilates is much better than in standard gym training. And third important aspect, it also adds flexibility to your routine. So if you love Pilates, then you should do it because it's one of the very good form of doing exercise. But then Pilates does not give you aerobic training. You have to, if you're doing Pilates, you have to add a session of aerobic training to improve your cardiovascular fitness and VO2 max. VO2 max is a kind of a fitness parameter for aerobic athletes. So the higher the VO2 max, the better you are in terms of being an endurance athletes.
Thank you, sir. There's one more question. Bhavesh sir has some questions if sir directly wants to ask.
Yeah, thanks a lot. I mean, I think I had one question I had asked earlier. Let me see. Yeah. Uh, so Sadashiv, I mean,
Yes,
I
sir.
had a question like, if I am a vegan, I mean, what would be a good vegan diet which would give me adequate proteins?
Uh, Vegan is very difficult, sir, because vegetarian diet is itself is a challenge. Vegan diet is much more difficult because there you don't consume dairy products also. So the only vegan product which can give you adequate protein is soy protein, because all others, paneer and everything, is dairy product. So in a vegetarian diet, things can be a little bit simplified when you eat different types of dals and you add paneer to it. Dahi has some protein, cheese has some protein. But if you completely cut off from that, vegan diet is a kind of diet where you don't consume animal products also.
Any
Dairy
dairy products.
है ना? So it is difficult, sir. Vegan diet, maintaining protein is very difficult with. The best protein in the world is animal protein. We have to accept that. There is nothing which beats it. And egg white is the best protein in the world. Egg white, fish, chicken are considered the best proteins. Why? Because their absorption is dependable. Their bioavailability is better. Their amino acid sequences are better. They are better used by myofibrils for recovery and strength. Next to it are vegetarian proteins or plant proteins. We call them plant proteins nowadays. Dairy proteins are in between, somewhere between plant proteins and animal proteins. So it becomes a really difficult task to, maintain 1 gram per kg body weight protein in a vegan diet. And I will request all of the people who are watching this, just for a day, on a normal diet day, just calculate the amount of protein which you eat. There are many apps which are there online. There is now AI app which you can just click the food of your thali and it will give you the approximate protein, fat, and carbohydrate content. Just see whether you are maintaining at least 0.5 gram. That is very important, because vegan diet and vegetarian diets are really big challenges.
Right. An extension to my question, like if not a vegan, if I'm a vegetarian, then
Yes.
I mean, how do I attain the 1 gram per?
Sir, vegetarian protein, the two proteins which are best in vegetarian diet are soya protein and you have paneer. Paneer is also a good protein source. So these are the two sources which we heavily depend on in vegetarian diet. Dals are good, but again, there are different types of dal. So tur dal has got less kind of protein than masoor ki dal. So there are minor differences in dal. But if you take one vati of dal or one bowl of dal every day and you say you are maintaining your proteins, that is not right. So again, the amount of protein in dal, the absorption of dal is very erratic. So absorption is a big problem. So if you eat, say, 10 grams of egg white and 10 grams of dal, only 1 gram of dal will be absorbed, while 8 to 9 gram of egg white will be absorbed. And so in a vegetarian diet, first and foremost, we depend on paneer and soy proteins. Later, then we depend on pulses, then dals for source of protein. And now we have supplements. We have to supplement this food with either protein shakes, whey protein shakes, or now we have plant protein extracts, which can be used.
Thank you, sir. One more thing. What is the significance of cheat day in weight loss?
What is the significance of
Cheat day.
cheat day?
Ah.
Cheat days. Cheat days for cheats. It does not
Name is
significant in weight
few
loss.
people say that it helps in weight
So
loss.
you don't end up
Doesn't?
you see when you are on a strict diet. So people who compete internationally or people who have got shows, who have to go to the podiums, who are professional bodybuilders, they have got very strict dietary regimens. They won't eat a drop of here and there for 3 months, 4 months, 5 months regularly without breaking that chain. And then mentally, central nervous system wise, you start getting bored. you start feeling low, then the interest of your interest in day-to-day activities come to an end. That is also called CNS fatigue. So regular exercise, too much strict diet brings that. So to break that routine, then you have a cheat diet. But you don't cheat diet every week or 2 days a week. You cheat diet once in months. So that is what is called cheating. If you cheat diet every day, every week, then it is a habit. Then it is not called a cheat anymore. But
So it
yeah,
doesn't help in weight loss.
no, absolutely not. It doesn't help in weight loss. Weight loss is calorie deficit, maintaining protein. Always I'll tell you again and again and again. Weight loss is calorie deficit, maintaining adequate amount of protein and fats and least amount of carbohydrates. So calorie deficit can be achieved by either decreasing calories in your diet or increasing your activity through eat or eat, right? By exercising, you are spending say 400 calories. So you can add 100 calories to your diet and maintain that deficit of 500 calories. So this is what it is. And then why do we exercise? So the question is, मैं भूखा ही रहता ना, उपवास ही करता हूँ, फिर मैं क्यों खाऊं? अगर इतनी मेहनत करना है, जिम जाना है, तो 500 कैलोरी कम ही खाता हूँ. Why do you exercise? You exercise for two key reasons. One is to maintain your muscle loss. So if you just do diet, you don't become fit, you become sick, you become thin, you lose your muscle mass, you have sarcopenia, you lose your density of bone, you lose your strength, you lose your vitality, your energy. When you do fasting or when you do calorie deficit diet and you maintain good protein, that helps you maintain muscle mass, strength, it helps you boost your immunity. Otherwise, when you fast, initially your immunity will go down. You will have cold, cough, idhar bayar dukh raha, udhar dukh raha. So many people are coming to me, urine mein burning ho raha. So it's very common, I'm telling you, it's not very uncommon. So to maintain your bone health, to maintain your muscle health, strength, energy, and vitality, you exercise. It's not only for spending calories. You can do 300 calorie ka exercise, put 200 calorie ka deficit in your diet, and you maintain a 500 deficit, the result will be the same. It won't change.
So there is one question. Do you recommend near complete protein replacement by whey protein?
No, we don't recommend that, but I wish I could, because whey protein is one of the costliest food on earth. It is one of the most expensive food on earth. So it's not good. Second important thing is the whey is good. See, it is isolation of that protein from milk. So whatever bad things are there in milk, they just picked up casein and whey. So why whey is popular? Because it works rapidly, and casein works over 7 to 8 hours period. So recommended is to, when you sleep, you take a shake of casein, but during exercise or after exercise or during day, you take whey protein. It is rapidly metabolized. That's why whey is very popular. The source of whey, since it is an expensive kind of protein, there are many spurious brands in the market. And that is where the challenge is. So the source should be good, the company should be good, you should be sure that there is no kind of addition or subtraction or some problem, spurious brand here. That is what, if you get good whey, then there's no food like whey as far as protein is concerned, because its absorption is, bioavailability is good. Now if you are not used to taking whey, I am taking whey for last 15 years. I take whey, in between I stop for a few weeks, then again I started. So it's been going on for 15 years. I don't have a problem right now. So what we do is, whey and casein both can be used. Whey, the problem is, if you're not used to taking whey, if you take one scoop immediately, it is difficult to digest. Protein is difficult to digest. So you'll start getting bloating and everything. So the most important thing is to start with half a scoop, then go on increasing the capacity. And I told you, I have personally coached few people, certain strength athletes, they take up to 2.5 gram per kg body weight. And without that, they don't achieve that kind of results which they want. So increase nitrogen balance, increase calories to put on massive muscle mass. That cannot be achieved without adding that much protein. So in our day-to-day fitness, at least we have to maintain 1 gram to 1.2 gram of protein per kg per day.
I have a question.
Yes.
So what is the basic difference between isolate protein and whey protein? Like they are in a different way.
So whey protein is a generic kind of protein, right?
And plant protein also. So I have three differentiations: isolate, whey, and plant protein. So what is the basic difference between these three?
Yes. So whey is basically a protein which is derived from milk,
Okay.
right? So when you derive it in the first stage, it is called whey. Now you want better results, you want less carbs, you want rapid absorption, and you want to increase the amount of protein which you get in one scoop. So you go to whey isolate. Whey isolate is more expensive than whey. So you go to a better, technologically better food product, that is whey isolate. So this is about whey. The other protein I told you is casein. It can also be taken as equally effective, but it gets absorbed over a period of 6 to 7 hours. Plant protein are protein which are derived from pea, chickpeas, everything. So they also follow the process ki nahi yaar, this protein is not good for absorption. This is not adequate, or itna protein jitna vegetarian diet mein chahiye. That protein, to consume that protein, you will have to consume lot of calories. है ना? अब आप आधा किलो चिकपीस तो खाएंगे नहीं, उससे कैलोरी कार्बोहाइड्रेट आउट ऑफ कैलोरी आउट ऑफ विंडो होगा. सो वी वांट a kind of a product which will give us 25 to 30 gram or at least 22 grams of protein per scoop
Per scoop.
with limited calories and low carbohydrates. That is our requirement. So that is why now we have started extracting protein from plant basis. So the Amway नाम का एक company था which was very popular during those days. So now it's not very popular, but during those days. So they used to come up with that plant protein. Now plant protein is globally available. It is available everywhere. If you're a vegetarian, if you don't want to consume whey, vegan people can use plant proteins.
Okay. So it will all depend on the impurities present into the brand which is there.
See, yeah, and देखो सर, महंगी शराब की बोतल रही तो उसका स्प्यूरियस ब्रांड बनता है, और सस्ती भाजी रही जो हर जगह काउंटर पे मिलता है, तो उसमें the spurious brand won't be making, because the person who is doing that branding, spurious branding, also needs to earn money. He's taking a risk. So, but in food, kind of food industry, what you buy and what you read on the label, you have to be extremely careful. There is no standardization like the medicines which use. It's a very strict body. So the drug kind of administration will be very strict on certain products. But when they come as nutritional supplements, they can pack anything and give you. So you have to be very careful. Now, omega-3 capsule, 1000 gram, 1 gram, 1000 milligram. So there is nothing, you don't know whether it is 500, 750 or 1000. You don't know what kind of fish oil is put into that, because there's no regulatory body to do that. Whey is available over there. So what we should do is, whenever we go outside India, and when we come back, you should buy whey. Instead of buying anything, buy whey and come back. So that is, you should buy a maximum. If you're traveling abroad, you should buy your supplements, because that is something. Electronic की चीजें यहाँ मिल जाती है इंडिया में, उसमें कुछ प्रॉब्लम नहीं है. Whey मिलना बहुत मुश्किल है, genuine whey. So you have to be careful. You can also go to consume the basic form of whey, which is very cheap. And they come in 1 kg brands also. So whey isolate is 2.5 times more expensive than ordinary whey. Ordinary whey is tasteless. It has got no taste and gives around 22 grams of protein per scoop and gives around 3 to 4 grams of carbohydrate. That is good enough. So you can add it with your milk and coffee, cold coffee, and put it inside and gulp it. So tasty नहीं, tasteless. तो उसमें स्पूरियस ब्रांड रहने के चांसेस कम है. बट जब आप ऑप्टिमम न्यूट्रिशन का या ऑन का प्रोटीन लेने जाते हो, दैट वन डब्बा इज कॉस्टिंग यू 5500. आइसोप्योर इज $5,500 for 1 kg. So if you buy that expensive protein, then you better be sure that you are getting it from a good source.
Yes.
So whey protein is recommended for everyone.
I wouldn't say whey protein. I would say protein is recommended for everyone, not whey protein. If you have got a baseline renal function which is normal, and then protein is very important. And protein is also important in patients who are diabetics, because diabetics tend to lose muscle mass more rapidly than non-diabetics. That is one thing. And so maintaining of sex hormones like testosterone or estrogen in women, you have to consume a little bit of fat. अगर आप patient हो diabetes के and you're not consuming fat, because fat से cholesterol का डर है आपको. वैसे 95% of cholesterol is formed in the liver. Only 5% is through the diet. So it's not what you eat fat to cholesterol ज़्यादा हो गया. It's actually a wrong concept. But however, when you are a diabetic, you tend to lose muscle mass. You tend to have low testosterone. You tend to have more muscle wasting. more osteoporosis or osteopenia. So in such a patient, जब वो physician को पूछता है कि सर मैं exercise क्या करूं, तो अपन उसको बोलते हैं चलो walk करो. वॉक करने से आप ऑलरेडी जो कॉम्प्रोमाइज सिचुएशन है उसको और ज्यादा ये कर रहे हो. इफ यू आर पुटिंग अ मैन on a exercise, aerobic exercise, he is going to lose more muscle. If you are going breathless and you are burning your calories to the extent where you're not consuming adequate fats and proteins, you're going to lose muscle. Now, exercising muscle consumes glucose directly from the bloodstream without the need for insulin, extra insulin pathway. So what we are doing is we are compromising this diabetic patient by asking him to do aerobic exercise, by asking him to stop taking fats, by asking him to reduce calories in diet because आपको दुबला होना है, and we are making more sick. हमने उल्टा बोलना चाहिए कि आप शुगर कंट्रोल करो, आप प्रोटीन ज़्यादा खाओ, so you will feel satiety. आप 30 grams of fat खाओ, so you will not crave for carbohydrates. So if you are full with fats and proteins, you usually don't crave to eat sweets. You have to give magnesium supplements. People who have got a sweet tooth, if you give magnesium supplements, that craving for sweets goes down. Then you have to tell the patient to have strength training, increase your muscle mass. You have to monitor testosterone if he's above 40 years of age and he's a male to see whether his testosterone level is optimum. If you use this, then long term, 1 decade after the patient has come to you, he will be in a much better state than a patient who is not. Also, I'm not a diabetologist. I don't want to get into controversies, but I can tell you from a nutritional point of view that if you're type 2 diabetic and if your doctor or diabetologist or physician says that you can take insulin, as a doctor, you start insulin early because again, insulin is an anabolic hormone. And if you're doing strength training, maintaining proper macros, taking insulin on the advice of your physician, then if you watch the coming decades, you will be in a much better state than a patient who is not.
Does stress test help determine VO2 max? That is a question by Dr. Pallavida.
No. Stress test is a test which basically evaluates the response of your coronaries or heart to the exercise challenge. VO2 max is a kind of a classification which is done for an athlete. So VO2 max we measure in an athlete to know his baseline fitness, how fit he is, how much fitter he is in endurance sports, or even in people who have got aerobic sports, moderate intensity aerobic exercise. Say 1500 meters ka running, 1.5 kilometers ka running race hota hai Olympic mein. That is a moderate intensity to severe intensity kind of activity. So in these patients, VO2 max is used. VO2 max is a baseline parameter of aerobic fitness. That is different. And stress test is effect of exercise on heart. Unmasking of a coronary artery disease. If the coronary supply is less, because your heart rate is increasing, and if the coronaries are not supplying adequate blood, then you will see the ECG changes of ischemia. So that is to unmask that particular patient where the coronary artery supply is less.
Thank you, sir. What is your take on apps like Healthify and CureFit? Would you recommend any such apps?
Yeah. Healthify is a good app. The only thing is nowadays they really, kind of they really bother you with their ads and everything, but it's an excellent app to basically do calorie counting and to give you macros. So when you basically log on what you eat, at the end of the day, you get a correct ratio of what you have consumed, how many calories you have consumed, and protein. So My Plate is one app which is very good. Then Healthify is good. But they do a lot of online stalking, so that once you take their app, then they will send you messages, then your Instagram will be filled with Healthify. So they do this online stalking. That is a part of their marketing strategy for giving you a free app. My Plate is good. There are many such apps. You can find it calorie counting apps, and you can just subscribe any one of them. Healthify and all other apps which have got an Indian background. So उसमें Indian foods है. जैसे if you say chana, 1 vati of chana or 50 grams of chana, then it will give you the exact kind of macros, split the macros. And your vati and my vati will be different. So quantification of diet is very important. Whenever we begin an exercise program or a nutrition program, you cannot say vati of dal or 1 bowl of dal because the bowls can be of different sizes. So we have to measure everything on a Kitchell scale in a raw form. So if you say 50 grams of chicken, that means 50 grams raw before cooking, and then you cook it. And if you add 10 ml of oil, then you add that 10 ml of oil calories to it. That's how you basically track and do nutrition quantification of nutrition.
One of the participants wanted to know regarding way isolate any brand which is good.
Whey isolate on nutrition protein is good, big muscles is good. There are multiple brands, but very popular brand. So don't go for the extremely popular brand. Go for a less popular brand, because less popular brand, people will not try to copy it. But see, when you go to a like Isolate P or something, these are very big brands and they are very expensive. So you should choose a brand which is slightly less. And there are many of them. Food industry is now flooded with thousands of brands. So you have to find out what is good in your area and take it.
So one more question. As you said, as age progresses in women, the muscle strength reduces as well as bone strength reduces, and there are higher chances of fractures and everything. But if already a vertebral fracture has happened, when after that, generally doctors don't recommend any much exercises. So, are there any simple exercises which can be done, or do they need to go for muscle training?
Uh, the studies of muscle training have also been done in 80 to 90-year-old nursing home patients in Japan. So the people who could barely walk were given some kind of resistance training, what they could have mattered. And the results were published after 8 weeks of physical activity, and the results were astounding. So any kind of physical activity, see, when there is a fracture, once the fracture has healed, the patient can move around. The patient is not bedridden. So once that is healed, we have to treat osteoporosis. But in addition to treating osteoporosis medically, we also have to increase activity. Increase activity, better nutrition, better treatment of osteoporosis, and all these facts come together in helping the patient to achieve strength. And ultimately, it is bone strength and muscle strength which gives you that quality of life which we want for that particular patient.
Thank you, sir. Thank you so much. I think these are all the questions, and you have solved all the queries. Thank you so much, sir. And
Thank you.
we would really like to thank all the participants and our chairperson, our speaker, and Dr. Bhave sir for introducing such a wonderful session and such a wonderful topic to us. Thank you, sir. Thank you, everybody.
Thank you, everybody. Thank you, Bhave sir. Thank you, West Zone, for giving me this opportunity. And thank you to President Dr. Bhave and the team. So I will go down in history as the first person who did this kind of, wellness, being a speaker in the first wellness program of West Zone.
Sure.
Thank you so much.
Surely, sir. We are highly obliged to have on this platform.
Thank you, sir. Should we end the session?
Yeah,
Thank you.
thank you.
Yes, yes.
Yes, sir. Yes, sir.
Thank you, Amit sir. Thank you, Sadashiv sir, for taking your valuable time and giving us the valuable inputs for having a most of the sedentary lifestyle of the.
Yeah, I would like to take just 1 minute.
Sure, sir. Sure.
Yeah, first of all, don't overthink all this health and fitness. First of all, पहले तो आप लोग सब लोग रेगुलर एक्सरसाइज करो. ये इतना कौन सा सप्लीमेंट खाना है, कौन सा ब्रांड खाना है, क्या खाना है, इतना ये सब मत सोचो. ये this the whole thought process is itself is wrong. First, you start exercising regularly, at least 3 times a week or 4 times a week. Whatever you want to do, 2 times strength training, 2 times whatever endurance sport or whatever you want to do. First, start doing all those things. First, get a consistency. Then figure out क्या खाना है, कौन सा macro खाना है, कौन सा micro खाना है, कौन सा brand खाना है. Honestly, I have been doing serious sports for last 15 years. I have not taken any whey protein or anything. I only used our Indian diet, Indian system, and I only supplement it with eggs. That's the only thing I do, and I have managed to perform at the most top level internationally, nationally. Honestly, इतना ओवरथिंकिंग करने की जरूरत नहीं है. आप लोग पहले तो रेगुलर एक्सरसाइज करो. पहले वो जो आपका मेट्रिक है कंसिस्टेंसी का वो लाओ. उसके बाद में ये सब सोचिए क्या खाना है, क्या नहीं खाना है, कितना खाना है, फिर ये सब आप लाइए। एंड ऑनेस्टली आपका जो घर का खाना है ना, वो बेस्ट खाना है, वो बेस्ट खाना है। बस आप उसको थोड़ा पोर्शंस कम रखो। जो अपना इंडियन फूड सिस्टम है बहुत अच्छा है, उसको आप सप्लीमेंट कर सकते हैं, एग से सप्लीमेंट कर सकते हैं। आपके घर में बहुत सारे प्रोटीन के दूसरे सोर्सेस हैं। इवन पीनट इज अ वेरी गुड सोर्स ऑफ प्रोटीन. So though you don't have to think so much about supplements, honestly. We first have to think about consistency, discipline. फिर ये सब आप सोचिए और फिर आगे बढ़िए, ठीक है ना. दिस इज माई जस्ट very simple advice to all of you are doctors. You all have to be investing some time on your health and fitness. You are the cream of the society. If you know, the more healthy and productive years you have, the more it is better for the society, because you will keep doing good things for the society for longer time, longer period. So don't overexhaust yourselves and die early at the age of 50. It is better to reduce your workload and have some balance in your life, and then keep working for 70, 80 years. Okay. That is what I am telling all of you. And don't overthink. First, consistency, discipline in exercise. पहले सवेरे उठो और पहले एक घंटा एक्सरसाइज करना सीखो, फिर उसके बाद में ये सब सोचो, ठीक है ना.
सही बात है सर.
Very true, sir. Very true.
बढ़िया
Thank
सर.
you.
सर सवेरे उठने से ही तो प्रॉब्लम शुरू होता है.
हाँ, वो पहले वो
कभी भी उठो,
वो लाओ आप,
कभी भी उठो, दिन में दौड़ो, शाम को दौड़ो, रात को दौड़ो, 10 बजे चलता
वो
है.
पहले करो. ठीक है. ओके, थैंक यू एंड इट वाज नाइस अमॉन्ग्स यू.
Yes, sir.
Thank you
Thank
so
you,
much.
sir.
Bye everyone.